CEN Written Exams Review 2023. Question 1. A patient is 32 weeks pregnant and presents with vaginal bleeding, abdominal pain, and contractions. The CEN should suspect: Option A, placenta previa. Option B, abruptio placentae. Option C, ectopic pregnancy. Option D, normal labor. The correct answer is option B, abruptio placentae. Abruptio placentae, placental abruption, is the premature separation of the placenta from the uterine wall. It presents with vaginal bleeding, abdominal pain, uterine contractions, and fetal distress. Placenta previa is painless bleeding, ectopic pregnancy is early gestation, normal labor is at term. Abruption is an obstetrical emergency requiring immediate delivery. Management includes 4 fluids, blood products, and urgent delivery. Question 2. A patient has a cut from a knife that is 2 cm deep and located on the palm of the hand. The CEN should: Option A, irrigate and suture the wound. Option B, check for tendon and nerve function. Option C, apply a pressure bandage. Option D, administer antibiotics. The correct answer is option B, check for tendon and nerve function. Deep lacerations on the palm are at high risk for tendon or nerve injury. A thorough neurological and functional assessment is essential to identify any deficits. The wound should be irrigated and may be sutured, but only after the assessment. Antibiotics are not routinely given for wounds unless infected or high risk, animal bites. Pressure bandages are for bleeding control. Question 3. A patient with a dog bite wound presents with redness, swelling, and purulent drainage. The CEN should: Option A, irrigate the wound and prescribe antibiotics. Option B, culture the wound and start empirical antibiotics. Option C, close the wound primarily. Option D, apply a pressure dressing. The correct answer is option B, culture the wound and start empirical antibiotics. Infected wounds, cellulitis, abscess, require cultures and antibiotics. Dog bites can be infected with Pasteurella, Capnocytophaga, and other organisms. Empirical antibiotics, amoxicillin clavulanate, are often started. The wound should be opened, drained, irrigated, and debrided. Primary closure is generally not recommended for infected wounds, they are left open for drainage. Question 4. A patient has anaphylactic shock. The CEN should administer which medication first? Option A, diphenhydramine 50 mg 4. Option B, methylprednisolone 125 mg 4. Option C, epinephrine 0.3 to 0.5 mg IM, 1:1000. Option D, albuterol nebulizer. The correct answer is option C, epinephrine 0.3 to 0.5 mg IM, 1:1000. Epinephrine is the first-line treatment for anaphylaxis. It causes vasoconstriction, bronchodilation, and decreased mediator release. The dose is 0.3 to 0.5 mg IM, 1:1000 concentration, in the anterolateral thigh. Antihistamines, steroids, and albuterol are adjunctive treatments and should not delay epinephrine administration. Question 5. A patient with a chemical burn to the skin should have the skin: Option A, neutralized with an acid or base. Option B, decontaminated with water. Option C, covered with a sterile dressing. Option D, treated with a topical antibiotic. The correct answer is option B, decontaminated with water. Chemical burns require immediate decontamination with water, irrigation, for at least 15 to 20 minutes. Neutralization is not recommended because it can cause exothermic reactions, heat, or further tissue damage. The CEN should remove contaminated clothing and irrigate the skin thoroughly. This may be done before the patient arrives in the ED, pre-hospital. Question 6. A patient's blood pressure is 200/120 mmHg with headache, confusion, and nausea. The CEN should recognize this as Option A, essential hypertension. Option B, hypertensive urgency. Option C, hypertensive emergency with end organ damage. Option D, pseudo-hypertension. The correct answer is option C. Hypertensive emergency with end organ damage. Hypertensive emergency is defined as severely elevated blood pressure, 180/120 mmHg, with evidence of acute end organ damage, neurological symptoms, renal impairment, cardiac ischemia, or retinal changes. Hypertensive urgency has elevated BP without end organ damage. This patient's neurologic symptoms indicate end organ damage, requiring immediate 4 antihypertensive therapy, e.g., labetalol, nicardipine, with gradual BP reduction. Question 7. Which medication is indicated for status epilepticus as a first-line agent? Option A, lorazepam, Ativan, 4 mg 4. Option B, fosphenytoin 20 mg/kg 4. Option C, levetiracetam, Keppra, 1 gram 4. Option D, valproic acid 20 mg/kg 4. The correct answer is option A. Lorazepam, Ativan, 4 mg 4. Benzodiazepines are the first-line treatment for status epilepticus. Lorazepam 4 mg 4, or diazepam 10 mg 4, is the preferred agent. If the seizure continues, second-line agents include fosphenytoin, valproic acid, or levetiracetam. Airway management and ABCs are priorities. Early treatment reduces morbidity and mortality. Question 8. A patient presents with chest pain, shortness of breath, and pleuritic pain. Vital signs: HR 110, RR 24, SpO2 88% on room air. The patient recently had knee surgery. Which diagnosis is most likely? Option A, myocardial infarction. Option B, pulmonary embolism. Option C, pneumothorax. Option D, pericarditis. The correct answer is option B. Pulmonary embolism. This patient has risk factors for VTE, recent surgery, immobility, and presents with the classic triad of dyspnea, chest pain, and hypoxia. Pulmonary embolism, PE, should be suspected. Wells criteria and PERC rule can help stratify risk. CTA is the diagnostic test of choice. Anticoagulation should be initiated promptly if PE is confirmed or strongly suspected. Question 9. What is the Glasgow Coma Scale, GCS, score for a patient who opens eyes to pain, makes incomprehensible sounds, and has abnormal flexion, decorticate, posturing? Option A 10, E2V2M4. Option B 8, E2V2M3. Option C 7, E2V2M3. Option D 9, E3V2M4. The correct answer is option C. 7, E2V2M3. GCS assesses eye opening, E2 to pain, verbal response, V2 incomprehensible sounds, and motor response, M3 abnormal flexion/decorticate. 2 + 2 + 3 = 7. A GCS 8 generally indicates the need for airway management, intubation. GCS is used to monitor neurological status in patients with head injury or stroke. Question 10. A patient presents with a severe headache, fever, nuchal rigidity, and altered mental status. Which diagnosis should the CEN suspect? Option A, migraine. Option B, meningitis. Option C, subarachnoid hemorrhage. Option D, temporal arteritis. The correct answer is option B. Meningitis. The classic triad for meningitis is headache, fever, and nuchal rigidity, neck stiffness, often accompanied by altered mental status, photophobia, and vomiting. Prompt antibiotics, within 60 minutes of suspicion, are critical. LP confirms the diagnosis. The patient should be placed on droplet precautions initially. Empirical antibiotics include vancomycin, ceftriaxone, and ampicillin. Question 11. A patient with a seizure disorder is in status epilepticus. The CEN should administer. Option A lorazepam, Ativan, 4 mg 4. Option B phenytoin, dilantin, 20 mg/kg 4. Option C midazolam, versed, 10 mg IM. Option D valproic acid 20 mg/kg 4. The correct answer is option A. Lorazepam, Ativan, 4 mg 4. Lorazepam is the first-line treatment for status epilepticus. It is a benzodiazepine that terminates seizures. If the seizure continues, phenytoin or fosphenytoin is given. Midazolam may be used if 4-access is not available, IM. Valproic acid is a third-line option. Airway management and ABCs are priorities. Question 12. A patient with testicular pain, nausea, and vomiting has a tender, swollen testicle that is elevated. Which diagnosis is most likely? Option A epididymitis. Option B testicular torsion. Option C orchitis. Option D hydrocele. The correct answer is option B. Testicular torsion. Testicular torsion is a time-critical emergency requiring prompt surgical intervention to salvage the testicle. It presents with sudden, severe testicular pain, nausea, vomiting, and an elevated, tender testicle. Doppler ultrasound is the diagnostic test, though surgery may be indicated without imaging if suspicion is high. Torsion is a surgical emergency. The window for salvage is typically 4 to 6 hours. Question 13. What is the initial fluid of choice for a patient with hypovolemic shock? Option A lactated Ringer's solution. Option B normal saline, 0.9% NaCl. Option C dextrose 5% in water, D5W. Option D blood products. The correct answer is option B. Normal saline, 0.9% NaCl. Normal saline, 0.9% NaCl, is the initial fluid of choice for hypovolemic shock, hemorrhage, trauma, etc. It is isotonic and rapidly expands intravascular volume. Lactated Ringer's is also acceptable but should be avoided in liver failure. D5W is not appropriate for volume resuscitation, it distributes into total body water. Blood products may be needed, but crystalloids are the first line. Question 14. A patient with suspected measles should be placed on which type of precautions? Option A airborne precautions. Option B droplet precautions. Option C contact precautions. Option D standard precautions. The correct answer is option A. Airborne precautions. Measles is highly contagious and transmitted via airborne particles. Patients with suspected measles should be placed on airborne precautions in an AIIR with negative pressure. Staff should wear an N95 respirator. Droplet precautions are for influenza, pertussis, and meningitis. Contact precautions are for MRSA, VRE, and C. diff. Measles requires airborne isolation. Question 15. A patient presents with acute pelvic pain, fever, and cervical motion tenderness. Which diagnosis is most likely? Option A ovarian cyst. Option B pelvic inflammatory disease, PID. Option C endometriosis. Option D ovarian torsion. The correct answer is option B. Pelvic inflammatory disease, PID. PID is an infection of the female reproductive organs, usually caused by sexually transmitted infections, chlamydia, gonorrhea. It presents with pelvic pain, cervical motion tenderness, chandelier sign, fever, and abnormal vaginal discharge. Treatment involves antibiotics, broad spectrum. PID can lead to infertility, ectopic pregnancy, and chronic pelvic pain if untreated. Question 16. A patient with acute pelvic pain, vaginal bleeding, and hypotension has a positive pregnancy test. Which intervention is the priority? Option A, transvaginal ultrasound. Option B, for fluids and cross-match blood. Option C, beta HCG level. Option D, surgical consultation. The correct answer is option B, for fluids and cross-match blood. This patient is hemodynamically unstable, hypotension, positive pregnancy test, vaginal bleeding. The priority is stabilization with 4 fluids and preparation for blood products, as a ruptured ectopic pregnancy is likely. While ultrasound and surgical consultation are important, volume resuscitation is the immediate priority to prevent hemorrhagic shock. Question 17. A patient with status epilepticus has received lorazepam 4 mg for without cessation of seizure activity. The CEN should anticipate which next medication? Option A, phenytoin 20 mg/kg4. Option B, propofol 20 mg/kg4. Option C, valproic acid 20 mg/kg4. Option D, levetiracetam, Keppra, 1 gram 4. The correct answer is option A, phenytoin 20 mg/kg4. After benzodiazepines, lorazepam, second-line agents include phenytoin, 20 mg/kg4, or fosphenytoin. Levetiracetam and valproic acid are also options but may be considered after phenytoin. Propofol is used for refractory status epilepticus. Airway management is critical, the patient may require intubation. Question 18. A patient presents with a snakebite on the hand. Which intervention is appropriate? Option A, apply a tourniquet. Option B, suction the wound. Option C, apply a splint and elevate the extremity. Option D, administer antivenom. The correct answer is option D, administer antivenom. Antivenom is the definitive treatment for snake envenomation. A tourniquet and suction are not recommended, they can cause tissue damage. Splinting and elevation are supportive but are not the primary treatment. Antivenom must be given as soon as possible, with monitoring for anaphylaxis. Question 19. A patient with pulmonary embolism has a Wells score of 6. What is the most appropriate diagnostic test? Option A, D-dimer. Option B, CT pulmonary angiography, CTA. Option C, V/Q scan. Option D, chest X-ray. The correct answer is option B, CT pulmonary angiography, CTA. In patients with a high pre-test probability for PE, Wells score 4, CTA is the diagnostic test of choice due to its high sensitivity and specificity. D-dimer is useful in low probability patients to rule out PE but has low specificity. V/Q scan may be used if CTA is contraindicated, e.g., renal failure. Chest X-ray may show other causes but is not diagnostic for PE. Question 20. A patient with a suspected pneumothorax has unilateral decreased breath sounds and tracheal deviation. The CEN should: Option A, administer supplemental oxygen. Option B, prepare for needle decompression. Option C, obtain a chest X-ray. Option D, place the patient in a supine position. The correct answer is option B, prepare for needle decompression. Tracheal deviation with decreased breath sounds suggests attention pneumothorax, a life-threatening emergency requiring immediate needle decompression. Oxygen is given but does not treat the underlying pathology. Chest X-ray should not delay treatment. The patient should be positioned upright if possible, a supine position can make the diagnosis more difficult. Question 21. A patient presents with a sudden onset of a severe headache, nuchal rigidity, and photophobia. The CEN should suspect: Option A, meningitis. Option B, subarachnoid hemorrhage. Option C, migraine. Option D, both A and B. The correct answer is option D, both A and B. Meningitis and subarachnoid hemorrhage share classic signs: severe headache, nuchal rigidity, and photophobia. The differentiation is made with imaging, CT for SAH, and lumbar puncture, LP for meningitis. Treatment for both is emergent. A non-contrast CT head is often the first test for SAH, LP is used for meningitis and if CT is negative for SAH. Question 22. A patient with ARDS requires mechanical ventilation. The CEN should anticipate which ventilator strategy? Option A, tidal volume of 10 to 12 ml/kg of ideal body weight. Option B, low tidal volume, 6 ml/kg, and plateau pressure 30 cm H2O. Option C, high PEEP and low FiO2. Option D, pressure support ventilation only. The correct answer is option B. Low tidal volume, 6 ml/kg, and plateau pressure 30 cm H2O. ARDS, acute respiratory distress syndrome, is managed with lung protective ventilation, low tidal volume, 6 ml/kg of ideal body weight, and plateau pressure 30 cm H2O to prevent ventilator-induced lung injury. PEEP is adjusted to optimize oxygenation. Higher tidal volumes are associated with lung injury. Pressure support is not typically used for severe ARDS. Question 23. Which finding is most concerning in a patient with acute abdominal pain, suggesting peritonitis? Option A, rebound tenderness and guarding. Option B, nausea and vomiting. Option C, diarrhea. Option D, fever. The correct answer is option A. Rebound tenderness and guarding. Rebound tenderness, pain upon release of pressure, and guarding, involuntary muscle stiffness, are signs of peritonitis, indicating peritoneal irritation. These are surgical red flags. Nausea, vomiting, diarrhea, and fever are nonspecific and can be seen with many abdominal conditions. CT imaging can help confirm the diagnosis: appendicitis, diverticulitis, perforation, or bowel obstruction. Question 24. Which concept is part of the Just Culture framework in nursing? Option A, balancing accountability and safety with a non-punitive approach to errors. Option B, blaming the nurse for errors. Option C, punishing all errors. Option D, avoiding reporting errors. The correct answer is option A. Balancing accountability and safety with a non-punitive approach to errors. Just Culture is a framework that balances accountability and safety, promoting a non-punitive approach to reporting errors. It distinguishes between human error, at-risk behavior, and reckless behavior. The goal is to improve patient safety by encouraging reporting and learning from errors without fear of punishment. It is the foundation of a safety culture. Question 25. A patient presents with a fractured ankle, severe pain, and inability to bear weight. Which intervention is appropriate? Option A, apply a splint and elevate the leg. Option B, apply a cast and discharge the patient. Option C, administer 4 antibiotics. Option D, apply a tourniquet. The correct answer is option A. Apply a splint and elevate the leg. An uncomplicated ankle fracture should be splinted, not casted, to allow for swelling, and the leg should be elevated to reduce swelling. The patient should be evaluated for a fracture and the neurovascular status documented. Casting is not appropriate until swelling has resolved. Antibiotics are not indicated for closed fractures.